Postpartum 101 by Senior Clerk Concepcion. This is my ate giving birth to my baby niece. Pregnancy is a process, but after 9 months, there are still more things to happen. For mommies, after delivery is the postpartum period, and it lasts for 4 to 6 weeks. These are series of changes that happen in your bodies, especially in the reproductive organs returning to its pre-pregnancy state. Here is a timeline of the changes. You can save this clip to have a quick guide in your own postpartum journey. I will be discussing the important changes. First is the vaginal discharge. In the first 1 to 3 days, it is the lochia rubra with a red color due to the mixing of blood. In the next 4 to 10 days, it turns to a paler pink color called lochia serosa. And in the 10th day to 8 weeks, it is white to yellow-white called lochia alba. If bleeding persists after the first 3 days, you may have some complications. Here are the 4 usual causes for vaginal bleeding. First is uterine subinvolution or delay in uterus shrinking. It is usually persistent bleeding for 1 to 2 weeks. Next is your uterine infection, where you have foul-smelling vaginal discharge. Third is your placental polyp, and lastly, placental fragment retention, characterized by persistent bleeding after delivery. If you experience any of this, it is best to consult your obstetrician immediately. After delivery, mommies also experience frequent urination, especially in the first 2 to 5 days. This is due to the greater bladder capacity, but return to pre-pregnant renal function occurs in 2 to 8 weeks postpartum. Breast changes are most noticeable in the 3rd to 5th day postpartum. To know more about breastfeeding, watch my breastfeeding video, link in the description. The uterus descends back to its original location in 2 weeks. By 3 weeks, the uterine lining called endometrium is restored, and in 1 month postpartum, your uterus returns to its pre-pregnant state. The weight gained during pregnancy is slowly shed off. By 6 months' time, mommies can go back to their pre-pregnancy weight. However, this is variable to your diet, physical activity, or if you breastfeed during postpartum. The return to fertility occurs 4 weeks after preterm delivery and 6 weeks after full-term delivery. Sexual activities can be resumed 2 weeks postpartum when the wounds are fully healed. Follow-up checkup is recommended between 4 to 6 weeks. It is important because there are also postpartum complications we need to monitor. First is a postpartum fever. Here are the 7 causes of this. Wind is for respiratory compromise or pneumonia. Water is for urinary tract infection. Womb is for endometritis or inflammation of uterine lining. Wound is for wound infection. Walk is for phlebitis or blood vessel inflammation and pulmonary embolism. Weaning is for mastitis or breast tissue inflammation. Wonder drug is for drug-induced fever. Aside from the physical changes, it is important to take note of your mental health during postpartum. Problems may be brought by hormonal changes during this period. Postpartum blues are the tearful mood swings for 2 to 3 days with the first 10 days of postpartum. Postpartum depression is a persistent feeling of hopelessness, anxiety, despair with neglect of self and her baby. This happens in the first 6 weeks. Postpartum psychosis occurs in the first 3 weeks. It is the persistent impairment of reality, hallucinations, and delusions with neglect to self and the baby. It is important to seek medical attention for any signs or symptoms above. Here are my references. And remember, take care of yourself, mommies. Thank you, and please subscribe to my channel.